Thank you very much, Wessex Health Partners, for getting us all together. I really like the idea that this is the start of the conversation, so looking forward to having more conversations in a minute. So I've got the privilege of talking to you about Health Innovation Wessex, and I've been there about a year. I'm the Deputy CEO there, and a couple of my colleagues are in the room, so I don't know if Nick, our CEO, wants to wave. We've got Philippa Danton, our Director of Insight, and also Leah from our Dorset team, as well as other colleagues as well, helping out for the day. So please do come and speak to us about our work. And the other great thing is that a number of you already know about us. So I don't really have to do much of an introduction, but I thought I would just take 2 slides to give a sort of reinforcement of some of those things you might know about us already. But those who don't know about us, giving an opportunity to introduce us as well. So we are the arm of the NHS England We are commissioned by the Office for Life Sciences and NHS England to be the innovation arm of the NHS. So we're looking at how can we support innovation adoption that delivers patient benefits, how does it deliver hours of healthcare staff capacity released, and how can we support economic growth. So we've got 3 commissions. Am I speaking loud enough now? Perfect. We've got 3 commissions. They're looking at how do we improve the pipeline of innovation that is addressing healthcare needs, how are we accelerating the adoption of proven innovations that, again, are delivering those benefits I just outlined, and how are we supporting economic growth. So I'm not going to go through the details on here, but hopefully it starts to show you what we think are the important aspects of our work. Now, we work as a national network of 15. That gives us the opportunity to work work across nationally, regionally, and locally. So we are able to deliver national programs, and we'll give a couple of examples of those in a minute, but we tailor them for the needs of Wessex. We also work across the regions, so we sit in the southwest and the southeast region, again, delivering regional activities. And what's really important to us is that about 50% of our activity, despite those national commissions, is agreed with you guys in the room, is agreed with how can we meet the system needs across Wessex. So what does this actually mean to you? This means that you have access to us as a system capability. So we are a membership organisation as well, with a lot of the organisations in this room represented on that board and guiding our work. But we are here to accelerate the adoption of innovation that's delivering impact to meet your needs. So in 25-26, we've started to put this together across 3 missions. So the missions you can see on this slide here are around how can we be that innovation adoption expert, delivering at scale and delivering that sustainability of the innovation adoption as well. How are we addressing those population health priorities to improve health and life outcomes? And how are we supporting economic growth through partnerships? And we talk about doing that with those 4 buckets of activities that are shown above, but I'm going through this quite quickly as an introduction to us, and therefore following on with more conversations. So, enough of an introduction. What does this actually mean, and what have we done in the past? So if you look at Mission 1 and looking at our ability to support innovation at scale, I've got 2 examples here. One was a homegrown innovation based in Wessex. So both of these were delivered before I arrived, so I don't want to take the credit for that. But Restore 2, which is a deterioration and escalation tool used in social and nursing homes, has been grown from Wessex and then scaled nationally through the patient safety networks and also the Work and Health Innovation Network team. This has won awards and has importantly led to the fact that working with nearly 12,000 care homes potentially avoided around 60,000 hospital admissions. On the other side, we've also have our national commissions where we've worked to support the increasing the access to fractionally exhaled nitric oxide diagnostic tests. This is looking at how can we improve the diagnosis and management of asthma patients. And through that program of work where we delivered training support tools as well as helping with the access to new devices, This has potentially supported the diagnosis of nearly 60,000 asthma patients. So just two quick examples there of work that we have led, especially the work on the right there, where we have led that as part of the national network, and also work where we've taken expertise from Wessex and delivered it nationally. So moving on to mission 2, which was looking at how do we address population health priorities. Equitable access to healthcare is obviously a key priority of our work and of Wessex's work. So two quick examples here. One is from working with colleagues in Dorset around looking at access to fecal immunochemical test. We're working with their Dorset team there to look at how can we engage with that Core 20+5 team, and we're really pleased that working with Dorset ICB engaged with over 900 members of the public to deliver that work and identified methods that could improve access to this type of testing. But this sat alongside a digital innovation that was adopted called See the Signs, and again we supported the implementation of that all across Dorset to improve access to this testing. The thing on the I'm trying to think if it's the right or left of your slide now, but anyway, on the other side is structured medication reviews. So this is a nice improved intervention, and working in this instance with 6 PCNs in Hampshire, looking at how could we improve access to this intervention for patients who are over 65 and on 10 or more plus medicines, where maybe there is a chance that they should be reducing that now when it was more appropriate to be on those medications when they were a bit younger. And this intervention has led to a number of new structured medication reviews being undertaken, but also, more importantly, patients and pharmacists liked the outcomes of this, and it delivered that impact that we wanted to see. We've already heard about the importance of women's health being flagged, I think, from both Dorset and Hampshire and Isle of Wight. And this is an example of some of the work that was carried out, led by Leah with colleagues in Dorset ICB as well, looking at how can we, particularly in this instance, support education and education tools for women across Dorset. At the bottom 2 bullet points are talking about a website that was developed and also some apps that were made available. But more wanted to focus on more was the work above that, where working with colleagues across the system able to support training that was helping healthcare professionals that were looking to work with women with pelvic floor dysfunction, and also supporting those women with this app that helped to support them in their care for that as well. So, final 2 slides from me, looking at mission 3, which was looking at how can we work with other partners that will bring economic growth to the region, but economic growth that will deliver benefit to us as a system. So we're really excited by a partnership, a long-term relationship we've had with a company called Lifelight, and which really does meet all the 3 shifts that have been highlighted earlier. So looking at how can we enable remote and easy contactless blood pressure monitoring from a phone or an iPad, and enabling that to be delivered in multiple different settings. This innovation will be supporting throughout this year, and we're looking forward to further conversations about this as the news progresses about their development. And the final slide from me, I did it timing perfect, 1 minute warning. The final slide from me, as you see, was just to rush through things, was and just to flag a piece of work we've done with Dorset, which is where, in partnership with the colleagues there, we submitted a proposal to the British Heart Foundation to support a primary care nurse-led secondary care prevention clinic across, I think it was 3 primary care networks that were setting this up. So just another example of how we can partner with you, such as through these sort of activities, and how this is supporting the adoption of innovations that will help different settings as well. Thank you very much.